Thank you, everyone. I'm Roger Fielding, the Associate Center Director of the Jean Mayer USDA Human Nutrition Research Center on Aging at Tufts University in the USA. I want to present to you the Healthy Aging, Geriatrics, and Sarcopenia project proposal. I just want to emphasize that sarcopenia currently is being defined as the age-associated loss of skeletal muscle mass and function. And I would argue that this is an unrecognized global syndrome of advancing age. We define sarcopenia as a syndrome characterized by progressive generalized loss of skeletal muscle mass and strength with the risk of adverse outcomes such as physical disability, poor quality of life, and death. And I believe that sarcopenia is one of the prime underlying substrates for the loss of independence among older adults. Much work has happened in the last 10 years in the development and recognition of sarcopenia. We currently have a specific ICD-10 registration code for sarcopenia that was established in 2016. I think there's universal global agreement that the components of sarcopenia include decline in muscle mass, decline in muscle strength, and a reduction in physical performance capacity. More recently, there have been novel approaches to the systematic, unified development of a definition of sarcopenia. Some of those initiatives have been occurring in Europe, the EWG-SOP2 from the European Working Group on Sarcopenia, an American consortium called the Sarcopenia Definitions and Outcomes Consortium, or the SDOC, and groups in Asia and Australia have also been working diligently to develop definitions and operational definitions for sarcopenia. Our project proposal is to identify nutrient requirement changes with age, because we think this has a profound effect on body composition with advancing age, particularly changes in muscle mass and function. To be able to identify valid and reliable screening and assessment tools for geriatric-related conditions and diseases such as sarcopenia, compare and contrast recommendations of existing bodies on the prevention, screening, diagnosis, progression, and treatment of sarcopenia, and really work with the ILSI Federation to determine needs of other regions worldwide on this important age-related syndrome. Over the next year, we'll establish a committee to address important gaps in aging literature on age-related nutrient requirements and valid and reliable screening tools for the assessment of frailty, sarcopenia, and other geriatric-related conditions. We hope that we can strengthen ties internationally between scientists and health professionals that will work on screening and assessment of these conditions, not only in the US and Europe, but in Australia, New Zealand, Singapore, Taiwan, and gradually expand worldwide. We hope to also begin work on a document that will sort of establish for the first time best practices for the prevention, screening, diagnosis, progression, and treatment of sarcopenia based on the results of existing literature and interactions with other authoritative groups and bodies. And this will only be accomplished by working with ILSI branches ongoing, but in particular branches dealing with similar concerns who we will contact first. And hopefully our ultimate outcomes will be the development of key publications on screening, assessment, and tools to evaluate sarcopenia and other age-related geriatric syndromes. We hope to publicize and widely disseminate this work by giving presentations at annual and regional meetings, work continually to expand our overall understanding and knowledge about sarcopenia as a syndrome of advancing age. And really, what's important, I think, globally is to develop simple screening tools to assess sarcopenia risk and begin to identify and intervene in the underlying lifestyle factors that increase sarcopenia risk. And of course, those are related to things like diet, proper nutrition, physical activity, and other potentially health promoting lifestyle behaviors. This has an enormous impact and global reach. When we think about the prevalence of sarcopenia being somewhere between 15 to 40% of the older population, really depending on age, the prevalence increases with advancing age. And when we know that the dramatic demographic transition that's taking place worldwide, if we look carefully at the proportion of individuals over the age of 50, comparing 2014 here to 2050, we can see the dramatic shift, not only in middle and upper income countries, but in lower income countries as well, this dramatic increase in the proportion of individuals living to older and older ages. And I just want to finish by mentioning that the fastest segment of the growing older population are individuals over the age of 80. And I think we know very little about their nutritional needs, their lifestyle behaviors, and what interventions really are going to help those individuals over the age of 80. Thank you very much.